And I want to thank our presenters today. Thank all of you. I really enjoyed everybody's testimony, and even though I may disagree with some of it, so my questions are going to be out of respect, and I'll try to be as kind as possible when I say this. I personally think the elimination of the advertising was pure evil. And I also want you to know that the cell phone companies spend billions of dollars to advertise. And I can tell you this, I probably get 3 or 4 emails every day. They want me to change my phone. I just bought a phone. Anyway, I'm going to move on to something that's very important to me. And that is the effect of these changes or these efforts by the current administration, how it affects women. Here's what I know, is that 90 million women ages 18 to 64 have had health insurance due to the ACA. 67 million women and girls have pre-existing conditions, and that the ACA was supposed to require health plans to cover a set of preventative services without out-of-pocket costs, including birth control, well women visits, and breastfeeding support and supplies, and that the ACA was also supposed to allow for essential health benefits such as pregnancy, maternity, newborn care, pediatric services, prescription drugs, mental health, substance use disorder. Now, so my first question, I'm going to have 3 questions, and I'm going to give all the questions first. So my first question is, how has the administration's attempt to dismantle the ACA undermined women's access to health? And I think the discussion on the junk policies probably could help us with that. And has it, if you know, shifted more women to Medicaid, especially for the birth of children? My next question, and I don't know, maybe one of you can answer this. There was an administration, in November, the administration proposed a rule to require insurers to send separate bills to customers for a portion of their premium that covers abortion. And this month, the administration proposed to require insurance companies that offer ACA plans covering abortions to also offer an identical plan in the same region that does not cover abortion. And I'm curious if you have a comment on how these new administrative burdens impact whether insurance companies continue to offer abortion coverage. And my next question is, and thanks to the ACA, 62 million women benefit from insurance coverage of birth control without out-of-pocket costs. I think I'm not going to go into all the effects, the good effects of birth control. Yet the Trump administration has issued rules letting virtually any employer deny workers this essential health care. And curious whether you have a comment on how the Trump changes undermine access to contraception. Who wants to answer?
I can address some of the issues that are more in my area of expertise and then leave it to others, because you raised a number of important points. First, on the issue of essential health benefits, I think you're correct that women face some particular risks if they inadvertently find themselves in a plan that doesn't cover these benefits due to aggressive marketing of short-term plans, due to confusion about what's covered. Mr. Hesselmeyer mentioned people paying for maternity care out of pocket. I will say, I don't know any middle-class family that can afford to go into a delivery without insurance and potentially be exposed to the very, very high costs that could accompany a delivery. Second, on the question of Medicaid, certainly Medicaid coverage also in some ways is disproportionately important to women because of coverage for pregnant women, because women sometimes are in the position of caring for their families and have low incomes and are enrolled in Medicaid. So I wanted to just respond to some of the points that were made about Medicaid coverage not providing maybe adequate coverage. Overall, the research on people who have coverage through Medicaid or through the marketplaces find that they are able to access care at rates similar to people in employer coverage. People with marketplace coverage, according to Kaiser surveys, report actually high rates of satisfaction with their access to physicians, both primary care physicians and specialists. and people who've gained coverage through Medicaid see improvements in access to care, as well as improvements in various health outcome measures. So not to say that the situation is perfect, but Medicaid offers strong coverage to millions of people, including tens of millions of women. Finally, on the contraception rules, as you say, the ACA's preventive services requirements included the requirement that insurers cover contraception without cost. Again, research by Kaiser finds that that's reduced women's out-of-pocket costs and improved access and adherence, which is really important. And the administration's rules, although I'm not an expert, have poked holes in that benefit mandate by letting employers who say they have any kind of moral objection opt out with no alternative way for their employees to get that needed coverage.